Khan, you say you're reimagining education. Could you tell us more about how you approach learning and education as compared to the more traditional approaches in teaching people?
Yeah, and I talked a little bit about this earlier today, and I write a lot about it in the book. The model of education that we have today is not the only way to teach. Most of us assume it is because that's what we all grew up in. It actually came out of literally the late 1700s, early 1900s, out of Prussia, where they were the first to say, hey, let's do mass public education. They knew that the best education was something that's personalized, that's at the individual student's pace. But they said that's not practical, that's not economical. We need to do it for 30 kids at a time with one teacher. So let's do it like a factory model. Let's batch them together, move them together at the same pace, grade them at different, like eggs, literally, grade them at different points in the process. The problem with that is it pretty much ensures that students have gaps in their knowledge, and those gaps accumulate as they progress, so at some point they're going to hit a wall. That's my personal belief why you have otherwise very smart, hardworking kids start to fail algebra, start to fail calculus, start to fail biology, whatever it might be. So what we say is instead of holding fixed when and how long you have to learn something and having variable how well you learned it, do it the other way around. What's variable should be when and how long you have to learn something, really focusing the attention on the student, and what's fixed is that you have a high level of mastery. Now, to some degree, this was obvious to someone even 400 years ago, but they said, oh, well, that's not practical. Even someone 30 years ago, even someone 10 years ago would say, yeah, that's obviously if you could personalize it, that'd be great, but we can't do that. What's exciting about, hopefully, tools like Khan Academy and others is that, well, no, these tools actually allow you to do that. You can have 30 students with one teacher, but now they can personalize the instruction. And when human beings get together, it's all about human interaction.
So you talk about reimagining education. We here at the Robert Wood Johnson Foundation think a lot about the future of health and reimagining health and healthcare. So let's pivot and talk just a little bit about that. In the United States and across the world, people's understanding about their health and health care in general is really, really low. Can you talk about using this platform to sort of address that problem?
Yeah, I mean, there's, I can immediately think of 4 or 5 ways, and we could probably brainstorm for another 5, not too long. But, some of the obvious ones were, your direct issue of kind of lack of public understanding of health issues is to kind of the stuff that you would normally this kind of knowledge you would normally get by talking to a doctor or a healthcare professional or talking to the expert in the field. There's no reason why we can't make very short videos that document the answers to the questions that, frankly, everyone should be asking or does ask when they have an ailment or when someone in their family has an ailment. And this affects all of us. We all have someone in our family who has something. And if you do that, one allows, even if you're in a rural part of the world, you can have at least kind of second, third, fourth opinions on a topic from the leading thinkers in the field. Some of them who might have divergent viewpoints. It allows the time with the physician to be much more constructive, where you can focus on much more of going deeper, asking very specific questions about your specific context. We could also do, obviously that same content could go much broader in terms of just general health issues, so that you get to broader health. So it's not, you don't have to wait until you got heart disease or diabetes. Right. You can prevent it. It's amazing. I actually did a video, I have a video on heart disease, several videos on heart disease, one video on diabetes, or 2 videos on diabetes. And how many kids watching those videos that literally just explain diabetes or heart disease say, oh my God, I don't want to, I'm going to stop eating sugar, or I'm going to stop eating fatty foods, just when they realize what's happening in their body when these things are happening. And so obviously you could do that for everything. You can do a lot of physician or health care worker training domestically. The value is it'll allow more time, like what we're talking about in K through college education, but for med school, it'll allow more time to be focused in the hospital with patients. It'll allow for lifelong physician training, lifelong healthcare worker training. Right now is kind of sporadic. Every 10 years they got to take a test, but they're just kind of left to their own devices. Then they could be up to date. I actually think journal articles in general should be done in this form factor. My wife is a physician, reads the New England Journal to keep up to date, but why don't you have the person who wrote that article just talk about it as a normal person? And they could refer to the data and they can refer to the article, but that will help my wife or other physicians keep up to date with what the cutting edge is.
You talk about the scale of 30 or 40 employees, and what is it, 50 million
Yeah, we reached 50
viewers
million,
across the world. That kind of scaling is astounding and really, really powerful. And we at the Robert Wood Johnson Foundation are always trying to explore ways to accomplish that sort of thing. Do you have any advice for us about how to translate that power to what we do in healthcare and health?
Yeah, I mean, my general approach to anything, and obviously this is the approach that the narrative of Khan Academy has started. I try to solve a problem on a very small scale, literally for Nadia, literally for my cousins. And when you do it at a small scale, there's no formality. I didn't have to go to the board. I didn't have a board. It was just some guy saying, "I'll tutor my cousin." And so very quickly I was able to get real life experience, really understand the problem, start to, in a very quick, scrappy way, develop tools that solved my direct need. It wasn't like this long research of like what might be a solution for the problem. Iterate very, very, very quickly, very close connection with the people using it. And while doing that, saying, hey, how can this scale? How can this scale? And now there's so many options to scale. I mean, videos and software, and that applies to almost any domain. See how you can get it to scale. But my general sense is if you can make it very useful for a small number of people, and then figure out how to scale, it will be useful for a much, much, much larger audience. And so sometimes what I see at larger organizations is that there is a hesitance to try something. And I mean, I use this as an inspiration too. I mean, I remember when I read about Muhammad Yunus in the 80s. I didn't read in the 80s. I was like 9 years old. But when I read about what he did in the 80s when he started Grameen Bank, he's this economist at I think at Dhaka University, and he's used to thinking of things at a very high level. How do you affect things systemically? But at some point, he just got fed up with it, and he went outside and talked to the woman begging on the street and said, "If I give you a loan, what would you do with it?"
Right.
And she did very good things with it. And then he said, well, maybe this was a special circumstance. Let me do it for a few other people. Hey, wait, it's not so much of a special circumstance. And he kept thinking about scaling and systemizing it. And he turned it so now he's uplifting 1 billion people out of poverty.